12:47, welcome back. Well, there's no doubt that it's good to take part in some form of physical activity, even some sports. It, of course, helps improve our health, overall well-being, but playing sports can also lead to injury. We are joined live by Dr. Maier. He's an orthopedic surgeon at Middlesex Health. He's going to hopefully teach us maybe how to prevent some of these injuries, and if we unfortunately do get one, how to treat them. Thanks so much for joining us.
Thank you for having me, Natasha.
So you focus a lot on ACL injuries. They are fairly common. Talk to us about what exactly this is.
Sure. So the ACL is a ligament that runs in the front of the knee. It helps to stabilize the knee, and it allows you to play all the sports that you want to be playing.
And especially come Thanksgiving, I know a lot of people play backyard football. Could easily happen during something like that. What are any prevention methods that you recommend to people to keep safe?
Sure. We recommend staying active, staying within your physical fitness level, not trying to do too much, not trying to do too little. And if you keep the knee nice and conditioned, usually that helps to prevent certain activities from happening and certain injuries from happening too.
So of course prevention is the ideal scenario, but that's not always what happens. So you treat ACL injuries with really minimally invasive techniques. Tell us about how you do that.
Sure. So traditionally we used to open up the knee entirely. Now we've gone more towards arthroscopic procedures. I had the opportunity to train with one of the pioneers in the quadriceps ACL graft, which allows us to take a graft from above the kneecap and put it in with very small thumbnail-sized incisions. We do most of our work with the camera that we use in the operating room, and that helps us to do everything we need to through very small little portals.
That is amazing. Technology is just always advancing, I would imagine, in your field especially. And let's talk about how long does a procedure like this take, downtime associated with that?
Sure. The procedure itself takes between 45 minutes and an hour and a half. Depends on what else is going on inside the knee, of course. Recovery is quite lengthy. We try to get people accelerated and back to the things that they can do, but usually it's on the order of 9 to 12 months of recovery.
Now, if someone is not sure, they feel like they may have hurt their ACL, what signs, symptoms should they be looking out for?
Sure. The biggest concern we have is with instability. So if it ever feels like your knee is funny, or it feels like there's some looseness to the knee and there's a big associated swollen knee, that's what is mostly concerning to us, especially after big pivoting injuries.
And I guess if you're always unsure, it's just best to see a doctor anyway.
We do like to see our patients,
yeah.
And if there's ever any doubt or any hesitation, we're always welcome to see patients.
Now there's something else you do, a quad graft, which is fairly unique. Tell us about that as well.
Sure. So that is a graft that we use from above the kneecap rather than below the kneecap. Traditionally, we used to use a graft from below the kneecap, but that's associated with anterior knee pain, bigger incisions. It still remains to be one of the gold standard procedures, but now we like to use a graft from above the knee, which does not entail any bony work, and it limits the amount of anterior knee pain that patients have after surgery.
Great. And of course you do all of this at Middlesex Health, correct? So people can come to you and you will assess really what's best for them.
Absolutely.
Wonderful. Well, we appreciate your time. I want to let people know middlesexhealth.org/ortho. They can learn all about what you do. Dr. Maier, thanks so much.
Thank you so much for having me.